talk about. One is a research project. There we go. And the other one is a community engagement and prevention project. Let me start off with the research project. And as you heard, most of the work that I do is in suicide prevention, but I do a wide range of different things that are also involved in other forms of violence prevention. So, from things that might have to do with youth violence to things that might have to do with gun violence prevention, those kind of things are part of it. This particular analysis is one that we just presented. Some of you may have just come back from the American Public Health Association. So I just presented this at the American Public Health Association. And what myself and the co-authors were looking at was the association between connectedness and suicidal thought and suicidal behavior. Some of you may be very familiar with some of the research literature that has shown that social connectedness is a protective factor against a wide range of different diseases. So, from chronic diseases such as cardiovascular disease and cancer to infectious diseases to things like HIV, but also in the area of injury, that social connectedness seems to be protective. And so what we did in this analysis was we looked at school connectedness among adolescents and whether it was protective against suicidal thought and suicidal behavior. This was just a little bit of the background for this particular study. We know that suicidal behavior is a leading cause of death and adverse health conditions among young people. So while it is the 11th leading cause of death from 2022, that's the last year for which we've got the full vital statistics death certificate data, 11th overall in the United States, over 49,000 deaths due to suicide in that particular year. But when you look at young people, especially these older adolescents, 14 to 18, it's the third leading cause of death. So you can see from there that it disproportionately affects young people. The graph that you see over on the right side is looking at that youth risk behavior survey from 2021 to 2022. They actually just released the 2023 data just a few weeks ago. But part of what you might notice about that is, especially since 2017, that the reports, and these are self-reports, it's a survey done in high school, self-reports of suicidal behavior. So this is a suicide attempt in the past 12 months. You can see that that's been going up. So from 2017 to 2019, from 2019 to 2021, you can see increases in self-reports of suicidal behavior among adolescents. Suicide is a multifaceted problem. And so there's a number of different factors and the environment that a person lives in that might influence their suicidal behavior. One way of looking at this is the social ecological model that looks at what might be some of the individual risk factors or protective factors. What about at the relationship level, which are oftentimes you're talking about peer and family? What are some of the risk factors and protective factors there? And then at the community level, and then similarly at the societal level, what are some of the factors there? And so as part of that, we wanted to look at school connectedness and see what that shows us. Our objectives were to determine if there was an association between school connectedness and suicidal thought and suicidal behavior. Now, part of what I'm doing today is I'm really kind of teasing you folks because I'm not showing you all of the results from what I did, although I'm going to talk about them a little bit. So what we looked at was there are 4 questions that relate to suicidal thought and suicidal behavior. Did you seriously consider suicide in the past 12 months? Did you make a plan regarding how you might go about that suicide attempt? Did you actually make a suicide attempt? And then did you make a suicide attempt that required medical attention? The question about school connectedness is ask if you felt close to someone at your school. Now, it did not specify in the youth risk behavior survey, didn't specify whether that was an adult, whether that was a peer, who that might be, somebody on staff, a teacher, maybe the bus driver, could it have been a cafeteria? But I didn't specify exactly who that was, but did ask, did you feel that you were close to someone at school. So now here's the teaser, and then I'm going to talk about the other particular project that I worked on. Was that, yep, it sure did look like school connectedness was protective, but it wasn't protective across all of the different aspects of suicidal thought and suicidal behaviors. I'm not going to tell you exactly what that was. If you want to ask me a question, I'll tell you something about it. But it did look like it was protective. We've seen in other aspects, looking at protectedness across a number of different factors, that it can make a difference what that protectedness is, or what that connectedness is, exactly how that manifests. Let me go on to the other project that I'm working on, and this is one in which it is much more of a community involvement and prevention activity. Some of you may be aware that homicides in the United States, especially 2021, 2022, were going up across the United States, especially in regards to firearm-related homicides. And so the city of Atlanta established, under the previous mayor, an Office of Violence Reduction. As they were working through it, they also asked for, folks that had some expertise, primarily in the city of Atlanta, but around the state of Georgia, to help them out. And so there's some folks from Emory School of Medicine that are working with them. There's several community-based organizations, such as 100 Black Men of Atlanta, also the King Center. Some of you are familiar, right? The Martin Luther King Jr. Center for Nonviolence is here in Atlanta. They are working with them. And some of us from Morehouse School of Medicine, including the Satcher Health Leadership Institute, are working with the city of Atlanta to develop some strategies, looking at the data, and also developing some interventions, understanding something about the risk factors and protective factors. How can we be as strategic as possible with doing implementation, maybe determining which neighborhoods, maybe determining certain age groups? What are some of the factors that are risk factors or are associated with interpersonal violence? And so here you can just see a graph. What did the United States look like in terms of homicides, and then what did Fulton County, which is where most of Atlanta is located? And you can see, yes, there was definitely an increase from about 2020 on through 2022. You've seen a slight decrease, but definitely not back down to, for instance, where homicide rates were back in 2018 in the city of Atlanta. So part of what we did is we looked at several aspects of reviews, whether those were systematic reviews, meta-analyses that had said, here's what we know about evidence-based programs, or the best available evidence. This is one that came from the RAND Corporation that looks specifically at firearm related injuries. And it talks about, here are some of the strategies, here are some of the approaches. So we took a look at that. We incorporated that into, what we were thinking about for the intervention. We also looked at a couple of documents that came from the Centers for Disease Control and Prevention. They had produced what they used to call a technical package. It's now called Resources for Action, to try to look at what's the best available evidence for programs that were successful regarding youth violence. So we had decided, based on looking at the data, that program, or that the influence of interpersonal violence was primarily affecting adolescents and young adults. So looking at the youth interpersonal violence, what were some of the strategies that had good evidence that they would work? And here you can see several of the ones here, the strategies and then the approaches. I'm going to conclude in terms of the last thing that I'll talk about, and then allow you to ask some questions. Here's a cartoon that I picked out of a newspaper. I didn't draw this myself, so this is the cartoon. And so, hey, teacher, we don't trust you with these books. So, there's books that have been banned. All right, teacher, you can't teach about that. We don't trust you with history. All right, you can't teach about that. We don't trust you with grammar. Here's some approved pronouns. We don't trust you with rainbows. That's not allowed. We don't trust you with art, because maybe the art looks, it might be construed a different way, but we do trust you with this. So, there are some states that are talking about or having some discussion about arming teachers in the classroom, and that it's sort of, kind of a funny way of thinking, right? We don't trust you with these things, but we trust you with that. So I'm going to stop right there. Thank you very much for your attention. I've talked about a couple of projects that I'm working on. I don't know if you have some questions about those or some questions about some other things that might be of interest to you. I will stop sharing and we'll see what you would like to talk about.
Thank you so much, Dr. Crosby. I have a question. I actually probably have several, but I will let others jump in and see if they have questions before I ask my question. Anybody have a question you'd like to ask Dr. Crosby about anything he presented?
Hi, yes, good afternoon. My name is Allie. I'm with Phoenix Counseling, and we have an adolescent program that works with children across 3 counties with mobile crisis. I was wondering if Dr. Crosby had like an email contact that I could email some questions to him because our time limit kind of constricts me with the questions that I have.
Will type my email address into the chat and you can send me an email.
Thanks so much, Dr. Crosby. Anybody else have a question you'd like to ask Dr. Crosby? So I have a question. I was wondering, several questions. I'm super interested, and I know you said you weren't going to share more about the school protectiveness, but I don't know if you can share any more about that, just in terms I'm just interested. I know school has also, well, I should just say being in school has been found to be associated, right, with other things like HIV. So in terms of protecting adolescent girls and young women, so I would suspect it is protective, and I would be super curious about, the if the relationships do matter in terms of who the specific, like how the specific connectedness is formed, and if it's, like if that connectedness, and you may not have this data, but whether having more than one person you feel close to actually, increases or decreases the suicidal thoughts or, that kind of thing in terms of you feel like you have a safe teacher and, maybe a couple of close friends or something. Anyway, I don't know. But anyway, if you can elaborate on any of that. And then I have a separate question too.
Sure, sure, definitely. I didn't want to be too mysterious about not giving you the results. I just wanted to kind of tease some people to
Oh,
see if
you
they would ask me,
did.
to see if they would ask me about it. Because yeah, of course, if I presented it at APHA, I had the results there. So that wasn't the tricky part. I just wanted to see if folks would ask me about it. One of the things that we found is that that school connectedness question, again, they just asked, are you close to somebody? Do you feel close to somebody at your school? Again, it didn't specify. It turned out it was protective against 3 of the 4 suicidal thought and behavior questions. So did you seriously consider suicide in the past 12 months? It was protective. Did you make a plan? It was protective. Did you make a suicide attempt in the past 12 months? It was protective. It was the question about, did you make a suicide attempt that required medical attention, that it turned out it was not protective. So part of what we're doing now is we're trying to figure out, okay, so what was going on there? Does that have to do with the dynamic of people who engage in, the questions are supposed to get, kind of to more and more serious suicidal thought and suicidal behavior. These are the folks for whom, at least on that questionnaire, this is the most serious, right? So they've made a suicide attempt that required medical attention. Turns out it was not protected for there. Is there something different about the dynamic or that process, or in some places in the literature, they've called it continuum, this continuum of suicidal behavior that's maybe a little bit different about this group in terms of that connectedness than about some others. Now, on another project that we did, and this has been several years ago, in which we looked at connectedness, but we asked some different questions there. There's more space in the questionnaire that we did several years ago than there is in the Youth Risk Behavior Survey. But we asked about connectedness to peers, and then a separate question about connectedness to an adult. It turns out that the connectedness to peers, actually, there was, I'll call it a dichotomy. That may not be the best word, but there was a dichotomy there because it depended upon that group of peers that you were connected to. And in this questionnaire, we could ask several other questions about that group of peers. If it turned out that you were connected to a group of peers that were, we'll call that more positive peers.
Mhm.
They were getting good grades. They were, involved in teams. They were active, doing a lot of, community kind of things. That was protected. You were
Mhm.
protected against certain kinds of adverse, whether that was substance abuse, whether that was suicidal behavior, whether that was, physical fighting in school, it was protective. But if you were connected to a group of peers that was more negative, as in peers that were skipping school peers in which were failing a lot of classes, peers in which there was delinquency, actually you were at greater risk for some of these kinds
Mhm.
of adverse behaviors than others. The question about adults really asked about a caring adult. So you really couldn't get a negative adult one on that one. So yeah, it was protective against adults, but it did make a difference in terms of what that group of peers was like when we asked that question on that previous survey. Again, the youth risk behavior survey doesn't ask that kind of thing. So, we're going to see what we can do to try to tease out some of that. Looks like there's another couple of hands up.
Yeah,
So I know, and I
I'll
know you
put
had a
my follow-up
second
question
question.
and
Okay.
I'll let I didn't see whether Carol or Elise was next, but maybe Carol, do you want to go?
Elise had her hand up first.
Oh, she did. Sorry, Elise.
No worries. I'm wasn't yeah. So hi. Yeah, my name is Elise Keefe. I'm a researcher at IPRC and I work on transportation safety and particularly interested in the importance of mode shift. So making sure there's more, opportunities for people to choose transit, micromobility, and walking. So I was happy to see that the built environment was noted as one of those opportunities for increasing connectedness. And, we know a third of people in the US actually don't drive, and the majority of those are children and youth, of course. So yeah, wondering if you could share more about this, any promising practices or research on that topic.
Yeah, there's several things in terms of environment, and maybe this is not as much in terms of built environment, but definitely we have found that what they call greening of certain, especially urban landscapes in which there's a vacant lot, or a building has been turned down. You turn it into a community garden. That actually that community cohesion, if you will, and that is hopefully promoting connectedness. Again, how the research has looked at that has shown that it actually decreases some of the adverse injury related outcomes, in particular some of the violence related outcomes, by having this community green space, and some of that is in that document. So there are definitely some things in terms of the built environment too, in terms of lighting on the streets, in terms of widening the sidewalks, that people feel they are more ownership, if you will, of my community. And so therefore, I keep a better lookout on what's happening in my community. If I see somebody that looks like they don't belong, I know most of my neighbors, I see somebody that looks like I'm more likely to report that, or, alert my neighbors. And so it actually promotes some safety within certain neighborhoods. And the same kind of thing. Again, I don't know all of the research on transportation, but some of those things may also be helpful in terms of making sure that what do we know about the safety in terms of preventing pedestrian injuries, or bicycle related bicycle related injuries, by improving what happens in the built environment in certain communities. For many of these, and maybe this is part of what we can kind of get to, is that there's oftentimes an overlap between different forms of injury and different sorts of health outcomes, that by improving somebody's connectedness, actually it helps with cardiovascular disease, helps with chronic disease, helps with injury, helps with several other things. So that some of these things, when you think about how we can improve health and wellness in communities, sometimes it doesn't have to be a little program over here that's this prevention, and this program over here that's this kind of prevention, and this program over here that's this kind of prevention. There's some kind of programs that might have an overlapping effect, and those might be the ones that we kind of point to and try to encourage. All right, I don't want to make the answers too long, because we got to get to another one.
Yeah, and I'm just wondering, Carol, would you mind? I noticed there are a couple of questions in the chat. Would you mind if we answer one of those before we go to you?
I actually was going to draw attention to that. That was one of the reasons my hand was up. Please.
Oh, great. Okay. Well, do you want to?
I also have questions.
Okay. Well, maybe we could just read this first one. Diane says, Dr. Crosby, several parent lost their son, daughter to suicide and feel language suicide prevention should be changed as parents feel their child's suicide was not prevented. What do you feel about this?
And generally, when we talk about, prevention, and I'm not going to talk about, across all different forms of prevention, but in terms of suicide prevention, we do talk about that most of suicides can be prevented. Not all, but most of suicides can be prevented. So in that sense, yeah, we can be very sensitive to what the parents have felt, or anyone that has experienced that in their family, that while we believe that we can prevent most of them, I've seen some prevention programs, for example, that have seen a decrease of 70%. They didn't decrease it by 100%, but they decreased it by 70%. So it may be that we're not speaking as if we can prevent every single suicide, but I think we can do a lot better. That's part of what that language is that we really think that we can do a lot better in terms of prevention if we get some of these programs into place, but we may not be able to prevent every single suicide. So yes, I'd absolutely be sensitive to that.
And then we have another question from Jesse, who says, I'm curious if the suicide attempts that required medical attention that were made were during extended breaks from school. So for example, like summer break or winter break. If so, what are protective factors parents can put in place during extended breaks from school?
Yeah, and we don't know the first part of your question. We don't know that because that question asked over the past 12 months. So we don't know the exact timing of when that suicide attempt occurred. That actually might be something. So this is, kind of the research idea, is you have to look at maybe things like, whether it's another survey that asks that specific question, or maybe emergency department data or hospitalization data in which they would have the date that the person was admitted or visited the emergency department, so that you could look at maybe 15 to 19-year-olds or 14 to 18-year-olds and try to find out when are the high periods in which suicide attempts are occurring. So that might be something, when there are breaks from school, especially if it does seem like this adolescent had a strong connection to somebody at school. Now we're on winter break, or now we're on summer break, and that connection is broken. Are there ways to maintain that connection? Again, the parents may not know exactly who that is, but are there ways to, again, people like to text or like to chat, or maybe a phone call, or maybe an email or something like that, where that youth can stay connected to that particular person. And sometimes it's finding out kind of what that connection is and how that youth might contact that particular person. Of course, many people, you may be aware of the 988 number, that there's a crisis line number across the country in which folks can call either for their own crisis or on the behalf of someone else. So they may be able to set up kind of a connection there, that the person could call that crisis line and get some help there. That might be temporary, again, for a while, until they can get something more long lasting.
Yeah. Okay, maybe Carol, just a quick question, and then we'll kind of wrap up because we're at 12:30.
Okay, I'll keep mine short. I had a whole bunch of them, so I'll be emailing you. Side note, I had a poster at APHA that was presenting an intervention to reduce anxiety and depression in teenagers in Robeson County, North Carolina, which has a large Lumbee Indian tribe population there. So I'm really interested in finding out where you go with your approach in interventions that you develop in the Atlantic area. So my question is, where are you in terms of developing that project? You said that you're kind of in a needs assessment phase of determining what's needed in that area, I think you said. Can you kind of close us out with a little bit more about that project and where you are?
Sure. And this project in the city of Atlanta is primarily focused on interpersonal violence. But, I think one of the things that, again, kind of has the overlap to it is there are some factors, if you think about, whether those are risk factors or protective factors for interpersonal violence, that also apply to self-directed violence. So, as we're looking through it, yes, we're kind of in the looking at the data availability, finding out, from, some emergency department systems, what we're looking at in terms of gun violence, what are some of the injuries from gunshot wounds? Also, what are some of the school surveys that we have that are available? And then also doing some interventions. Now, one of the things that the city of Atlanta has already started to implement and started to put into place are, if some people may be familiar with kind of the cure violence folks and violence interrupters. And so part of what they do is these are people that have neighborhood or community credibility, but are trained in terms of interrupting violence. And Gary Sklutkin, who was the developer of this, has this piece in which he thinks that some forms of violence are contagious, in the sense of you will often have somebody that is a victim of violence that will then go out and either seek revenge or take that violence out on somebody else. So there's a contagious aspect to it, that it spreads. That's where the contagion is. And so these violence interrupters that they've now started to deploy in some neighborhoods in Atlanta, try to interrupt the violence from escalating and spreading to other places. So that's already in place in Atlanta. And we are seeing about other aspects, including, working with the mayor. One of the things that they've also identified based on some of the data that we've had, and then some national data too, is that oftentimes with youth, it does have to do with unemployment, that the youth are not able to get jobs. And so there's other things that they do, whether that's, through the other kind of markets that are available. And so it's providing a jobs and job training programs for youth, especially during the summer, but then also some after school stuff. So there's a few things that are already in place. We're also still looking at data and seeing what we can identify from some other pieces, and especially within certain neighborhoods, to try to inform what we're going to do, and then talking with community members to figure out, okay, what's the program, or what's the intervention that you think is going to work best here, that we've got some evidence for. Let's discuss it and let's see about how we can put it into place.
Great. Well, thank you so much, Dr. Crosby. Really enjoyed your presentation and this discussion. And I know Dr. Crosby provided his email address, so and it sounded like he is open to receiving emails. So thank you for that. Please email Dr. Crosby if you weren't able to answer or ask your question. Yeah, thanks so much. And thanks everybody for joining the webinar today. That was really great. So thank you for joining us.
You're quite welcome. I enjoyed it. Take care.
Take care. Bye-bye.
All right.
Bye. Oh, that was so good. Okay, I'm emailing you. All right. Bye, Dr. Crosby.
All right. Fantastic.
Thank you so much.
You are
Thank you,
quite
Dr.
welcome. You are quite-
Crosby. Take care.
All right. Thank you.